as retinol. The people are applying the retinol and they don't actually know what it is that the retinol is doing. There's the top layer is called the epidermis. That's the skin that these skin cells on. All right, welcome back everyone. My name is Dr. Saadat. I'm a Beverly Hills plastic surgeon. And for today's topic, we're gonna talk about a very popular skincare product known as retinol. And I'm gonna explain to you what exactly it does and why you should probably be using it. Now, retinol you probably see on a million different products throughout Sephora and a million other convenience and makeup stores. But a lot of times I notice that people are applying the retinol and they don't actually know what it is that the retinol is doing. They just know that it's good for anti-aging, which is true. But ultimately what retinol is essentially a derivative of vitamin A. What does this do to your skin? Well, when you put it on your skin, what the retinol does is it penetrates to the deeper layer of your epidermis. So your skin has a couple layers. The top layer is called the epidermis. That's the skin that we see here. Underneath it is what's called the dermis. The dermis is that thicker connective tissue layer. And what happens as we age is both of those actually start to thin. And that's why our skin, especially as we get into our 40s, 50s, and 60s, oftentimes will become more crepey, thinner, and therefore show more fine lines more often. So what does retinol do? Like I said, it penetrates that base layer and it actually ramps up the level of production of skin cells that's occurring in that area that you're applying the retinol. So essentially what you can imagine is you have this bottom layer of skin cells, and those are the skin cells that are producing these skin cells on top. And it's almost like a tree with tree bark. So essentially that bottom layer is now activated to produce even more skin cells. So what does it do? It starts pushing all those dead skin cells out and sloughing those off. So in quite literal terms, you do have fresher skin, and it is a form of a chemical peel in a lot of ways. What it is doing, it's sloughing off that skin, it's allowing the skin to make more layers, so the epidermis is actually thickening, and it is helping the dermal layer to also thicken as well, which will give you a nicer scaffolding to have that top layer of skin on. Therefore, you will have less likelihood of showing things such as fine lines and wrinkles, and it will also help with things like dyspigmentation, such as melasma, or areas of sun damage that may have accrued over the years of you being in the sun and not listening to my advice and putting on SPF every 2 hours. Yes, I said every 2 hours. I know it's a pain in the ass, but sun damage is more of a pain in the ass. So that's why I recommend that you wear SPF. But ultimately, one thing to really know with retinol is yes, you should definitely be using it as a part of your skincare regimen. But if you are using it, one of the most important things to understand is that because your skin is quote unquote fresher and the effect of the retinol taking action, your skin is going to be more sensitive to the sun. So you're gonna have to be extra vigilant about putting on SPF and really using physical protection such as hats and cover-ups in order to protect the areas on your body that you are applying the retinol. And the other thing I was gonna say too is that a lot of times people just think of retinol for the face and neck because that's where they're most worried about their age showing. But one area that I notice people are often neglecting, the back of the hands. The back of the hands are an area on the body that really show our age, and especially because of driving and being outside, our hands are getting a lot of sun exposure. So on top of putting SPF every 2 hours on the back of your hands, especially if you're outdoors, it's important that you also do the retinol on the back of the hands to allow for that skin to remain thickened and to prevent those signs of sun damage that may occur over time. So how do you apply the retinol? Well, first of all, I do typically say that the ones that you buy over the counter are not that reliable in the amount that you're getting. Sure, they promise a certain percentage, but ultimately I think you're better off going with a prescription strength retinol. One thing I tell people all the time is personally, I like to have it where you wash your face at night, you put on all your products, your moisturizers, and then retinol is the last thing to go on. Why do I say it's the last thing to go on? Because I don't want you putting the retinol and then rubbing it all over your face, especially the eyes or sensitive areas like right here at the corner of the nose or the base of the ear, because those areas can get irritated. And another important thing to know with retinol is that it's all about graduating up in frequency of use. So what you do is you start off with once a week application, then you go to twice a week application after a couple weeks, then 3 times a week, then 4 times a week, working your way up to every day. Now that's gonna take time because your skin's gonna have to get used to it. Like I said, it's essentially resurfacing your skin. So if you start putting it on every day, it can very likely burn your skin because it is a chemical reaction that's occurring. So if you're interested in retinol and are curious to know more about it, or are curious about any facial rejuvenation procedures that you can have done in order to re-youthen your face, go ahead and contact my office and let's chat about it. Again, I'm Dr. Saadat. This is my YouTube channel. Go ahead and comment, like, and subscribe to stay tuned for more videos.